Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to address a career pivot on your resume or in a job interview for medical coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so if you are coming into medical coding from another industry, completely unrelated, it is okay. You are in good company because a lot of people will find this out about health information, medical coding, medical billing and coding later in life, and so that's when they decide to pursue it. But sometimes people get a little nervous because they've been in XY industry for 20 or 30 years, and sometimes they think, is this going to be difficult to transition into coding? The thing you have to know about coding is that coding involves a lot of different skills, and there's many different jobs that have those skills that they use on a daily basis that can transfer over into coding. For example, if you have spent any time protecting anyone's private information, whether you were a teacher, because teachers cannot go and talk about their students willy-nilly, okay? Whether you were a teacher, whether you worked at a bank, whether you worked at the Dollar Tree or the Dollar General, and you had to keep private those your employees' information for like payroll and things like that. These are all things that are very inherent to what we do as coders because we have to protect information. And when you're talking about it on your resume, all of your skills that you had on your previous jobs, you want to talk about things that are going to transfer over. That's what you want to highlight. You don't want to talk about, oh, I ran XYZ reports for a QID summit. We don't even know what any of that means. Don't ever put something like that in your resume. I see that a lot when people post their resumes on LinkedIn and then they're wondering why they don't get hired because we don't know what the heck you're talking about. What are these reports and what are they relating to? Now, if you would have said, well, I ran reports that included client or client private information that I kept secure, that's something that's going to get my attention as a health information professional who's hiring, right? That's going to get my attention. So that's something that you got to think of. What did you do that is going to help you in your position as a coder? If you had to keep track of serial numbers, or if you were doing inventory and you had to match up numbers, that's something else you can talk about because again, we have to know numbers and letters as coders because of the codes and because when we're looking at the records, we have to verify and make sure that we are on the correct record because oftentimes we'll have two screens going at the same time where one screen will have the electronic health record, the other screen will have like an encoder or something, or it'll have the data bank that we need to enter the stuff into. Sometimes it's on the same page, but we still need to make sure that we are verifying that we are on the correct patient. So again, if you're having to match up serial numbers, if you're having to match up product numbers or any of those things, that's something that is a transferable skill. So even if you came over from Amazon fulfillment and you've done that for the past few years and you've decided to get into coding, that's something that you can put onto your resume as far as this is your skill that you had to match up numbers and serial numbers and product numbers and order numbers. Those things are important and they're great for transferable skill. Now, again, if you are talking about keeping things private, if you are talking about that you had to manage money, if you made any deposits, if you worked at a restaurant and you had to keep track of your tips or had to make deposits for the restaurant, that's another thing that can be transferred over because again, you may not start off in coding. You may end up starting off in billing, and that's okay because billing is going to give you a great foot in the door job, right? It's a great foot in the door job because it's going to give you access and exposure to the codes and to the electronic health record, and that will help get experience so that when you continue to apply for a coding position, you can have that on your resume that you worked with Epic, you work with Cerner, or you work with eClinicalWorks, any of those. And or whatever electronic health record they have at that facility, but that you did that and you were able to do all of those things. But keeping track of money, that's very important, because that shows that the person can trust you as well, because you can't trust somebody that you know is going to steal and be able to trust them to make deposits for money and things like that, or trust them enough to take people's credit card numbers and things like that when you're processing payments. So if you had to do that as well, that's another transferable skill, that you took credit card numbers to process payments. And those are the things, again, that they're looking for when they're looking for a biller. So there's a lot of things that people don't think about, because they just get so obsessed with, oh, well, I only did this, and I don't know if I can, have enough experience to get over into coding. You're counting yourselves out before you even get in. And that, I don't understand why people are doing that. You have so much to offer the industry. The industry still needs to grow, but it needs people that are competent, and it needs people that are going to be able to recognize their own skill. So if you start doing that now, that will be even better for you for the future, right? As you get into this field and as you start navigating your way through health information. So, but that would be my advice when you're out there and you're talking about your career pivot. And even when you are in an interview and they say, well, you've only been a teacher for the last 10 years, so tell me what makes you want to get into coding. Well, you can talk about any reason that you want to, but you really kind of want to highlight your skills that you had gained as a teacher that you can bring over into coding. And you could say, well, in working as a teacher, I've had plenty of experience working with diverse personalities, obviously, right? These children, the administrators at your school, other teachers. And so a lot of these things are, again, transferable. So that's when we want to say that you can collaborate with others from different backgrounds, and that you can listen well, and you know how to diffuse arguments, things like that. That's all really important, because sometimes when you're having to do provider education, they may not want to be educated at that moment. So they may get upset. But if you're a teacher and you already know, hey, I'm a teacher by nature, and so and profession, and this is, I can recognize different learning needs. That's also really important, especially when you're becoming a coder. And again, you may have to educate providers before any of you panics, because I know everybody always starts to panic. Oh, I've never been a coder before. No, but you do have the knowledge, and that knowledge can be imparted on that provider, regardless of whether you are just barely starting in the industry or you've been in for several years. Being able to educate providers is really important, because we know this stuff, right? We got tested on it. We were made to understand it and everything else, so we can explain it to other people. And you, if you're coming over from being a teacher, whether it was an elementary school teacher, middle school teacher, high school teacher, college professor, whatever, when you can say, I can spot different learning needs, that's a very, very powerful skill. Because if you know that a provider, just by recognizing from their behaviors that they are a more visual learner, you're going to know how specifically to tailor the education to that provider so that they can understand better, right? If you know from your experience that this person is better if they have it written down, that's another thing, again, that's just more powerful, because you're tapping into that skill that you've already cultivated for several years and bringing it over into coding. I talk to my clients all the time whenever I'm doing resumes, and they tell me that they get a little nervous. They're like, Bleu, I've only been in this industry for all these years. Talking about it just makes me nervous. And I'm like, no, you need to think about all the ways why you would be a good coder, why what you have, and marrying that up with the coding training that you've gotten, why you would make an excellent coder. Okay, so there's again a lot of things that maybe y'all are not thinking about. But what I would recommend is this: when you're going through the job listings, look at all of the qualities and the skills and everything else that they are asking for. The fact that you know HIPAA, or that you can protect private information, that you are organized, that you can work with diverse people and things like that. Those are things that are really important. So think about when you did that in your previous job, what did you do? If you are saying that you're organized, which please do not put that on your skills list, I would reject your resume. If you put skills on your skills list, that you put you're organized and you're a team player. Why? Because your skills list is about your hard skills. I don't care that you are organized, that you're a team player, that you can answer phones. That's not a skill that that's not a hard skill that I'm looking for. The hard skills that we're looking for, ICD-10-CM, CPT, Hicks-Picks, medical terminology, anatomy, pathophysiology, that's what we're looking for in health information. Everybody's organized and everybody's a team player. But if you're saying that in your resume, as far as like what you did in your previous job, tell me how you were organized. Did you have to reset up, I don't know, some kind of filing system? That's something that you can put into your job duties that you did. Okay, so that's another thing that you can think about when you're talking about your past experience and how marrying it up with the coding training is going to be a good thing for their organization. Okay, it's all about believing in yourself and believing in your skill. You clearly went through the program. Now is not the time to rethink, oh my gosh, what do I do? And how is that going to make any difference? Or, Bleu, I haven't worked. My favorite ones is when people tell me, Bleu, I haven't worked in 15 years because I've been raising kids. You think that's not a job? You think that's not a job? Children are a full-time job. They are a full-time job. Why? You have to be able to keep track of their allergies. You have to be able to keep track of their medical history. You have to be able to keep track of their learning needs. So those are things, again, putting on there that you have been a homemaker or that you have been a stay-at-home parent. I would put homemaker, I would put caregiver, something along those lines. And that's okay because health information is dominated by women. So a lot of women in here are mothers and they understand that what it means to raise kids and things like that. If you're saying, oh, I can't do it because my kids are little, there's a lot of people who do this as coders and their kids are little. So really it's up to you. Sometimes people don't think that there's that option out there, and there actually is. So if you stop putting those barriers up, you'll be able to see them as well. But that's a full-time job. Being a parent is a full-time job, and especially if you have a child who has medical conditions and things like that. You don't have to go into the medical conditions thing, but you can say that you understand whatever the condition is, right? So if they have a musculoskeletal condition, you can say, I have you can say something like, I'm trying to think on the fly, but you could say, have an in-depth knowledge of the musculoskeletal conditions. You don't have to say the reason why, but you can say that, okay? Because that's something that you do know, that you are bringing over. But when you are in the interview, I will caution you, as I always do, that when you're talking about your previous experience and then you want to start talking about your family. I had one lady that I was doing a coaching session with, and she kept circling back to family, and I told her to stop doing that because they don't need to know. They don't need to know your personal family history. And sometimes people get so excited they want to share pictures of their kids, and they want to talk about their spouse, or they want to talk about their boyfriend or girlfriend. That's all fine and well, but again, these people are not your family. They are not your friends. You can look at them like this so they can get you to calm down and it can get you to relax, but you still need to be a little bit guarded about what you share, because anything that you share can be used, it can be manipulated, it can be changed around depending on who you're speaking to. And I'm not saying this to scare you. I'm telling you so that you are prepared. A lot of people spend a lot of time running their mouth and they wonder why can't I get hired? But if they're asking you about you and you get so excited talking about your kids and you spend an hour and a half showing pictures of your kids, do you think that somebody in that room is going to still want to hire you after all of that? This person's too distracted. They're not able to stay on task. We need somebody who's going to be able to stay on task. So that's why I say it's all fine and well to be proud of your kids. I'm not saying to not be proud of your kids. But what I'm telling you is when you're in the job interview, that is not the time to talk about your kids. Now, once you get hired on, and if somebody asks you about your kids or whatever, and you want to share a little bit, that's okay. But not when you're trying to get hired. Everything needs to be about the career right now. And it needs to be about what you're bringing over as a skilled professional. That's what it needs to be about. Okay. If you say, well, Blue, I didn't raise kids. I've just stayed at home and, we didn't have children. Okay. Did you volunteer at the church? If you volunteered at the church, this is also applicable to your work history because you're not doing this for free, okay? Even though, yes, it is for free, you're giving your time, but you're still being able to build skill. If you are a volunteer at the church, right? And I'm just saying church, it could be anything, guys. I'm just saying church, all right? But if you're a volunteer at the church, and let's just say you collected the donations, again, money handling, being able to be discreet with what the parishioners are donating, right? The amounts of things like that. You're not running around saying, oh, Sue, Jane, and Sally just donated $1,000, but such and such only did $20. You know what I mean? You're not doing that. Not in the church. At least nobody that I have known that has collected funds has ever done that. So, but that's just something that, again, transferable skill. If you taught the Sunday school, again, that's a teacher. That's being able to work with diverse populations of people, young and old, and being able to reach and talk to the person and being able to help them to understand the content. You don't have to specifically say about all these things about church, but you can say, I help them to understand the content of the material being taught. And that's just as fine, guys. All right. So think about those things, there's a lot of things that people do with the church. Sometimes they just help out around the church to keep the church, organized, or they do like they help with the party setups and things like that. Again, that's being able to take direction and being able to make a space transform, right? Because you worked as a team and you were able to follow directions. So again, that's something that is transferable. You were able to meet deadlines. If you had to bake cookies for the church bake sale, again, you met a deadline because you baked an item, right? Whether it's cookies or cake or whatever, and you brought it over to the church. You know how to follow directions when it comes to, managing your time and things like that. So these are all things that can be phrased and put onto your resume so that when you're talking about your skill and everything else that you're bringing over, the education that you've had, this is going to make it a lot more easier for them to know, okay, this person understands what we're about. And there are some people that they will ask, some of these interviewers will ask, okay, explain to me, how do you look up a diagnosis code? Explain to me how you look up a CPT procedure code. And there's a lot of people who can't do that. I don't know why. Y'all should know how to do that. There's no excuse to not know how to explain how to look up a code. Because even if you have not been a coder, you still know, or you're supposed to know, how to look up the code. If you can't do that, if you cannot explain that, you need to work on it. There's no excuse. Literally none. Please, no. There's no excuse, because you can always get your book. You can start working and practicing with the workbooks. And so that way you can start covering up the answers. I'm going to do that on another video too, where I'm telling you all about that. But cover up the multiple choice answers and start looking up codes on your own. Before you start hyperventilating, the real world is not multiple choice. They're not going to give you the answers in the real world. And if you say, well, I heard that we will only pick whatever the provider says, the providers are not designed to be coders. That's why we have jobs. And a lot of times these providers are selecting the wrong codes. They will select an unspecified code. Their code will not be as specific. It will be incorrect based on the 7th character, A, D, or S. And there's a lot of other things that go into that. The sequencing may be off. So you cannot trust that the provider is going to be right 100% of the time, because 90% of the time, 95%, depending on how well they're trained, it could be wrong. Something's wrong because they're not designed to know the rules. That's why we have jobs. And their responsibility is to take care of the patients. That's what they do. Okay. If you were a volunteer at the hospital, sometimes they do have like Red Cross volunteers and things like that at the hospital. And if you did that, if you volunteered at the gift shop, again, those are your people skills. Those are your instructional skills. Those are your, matching up inventory numbers and taking inventory. Again, all of those things are transferable. All right. But again, before I wrap this one up, I will tell y'all to look at the job listings about medical coders to see what they're looking for. What is specifically that they're looking for as far as their actions and everything else. And if you did any of that in your previous work, then you need to make sure that that is on your resume. So that way they know, because they don't know you from Adam or Eve. They do not know you. And so the more you tell them about yourself, but only to a certain point. Your resume should not be more than 1 page, okay, for my new people. If you are an experienced coder and your resume goes to 2 pages, that's totally fine because you've earned it. But to my new people who are transferring in and doing that career pivot, you need to not be on 2 pages. You need to be on 1 page, period. There's no excuse. And you don't go back more than 10 or 15 years because they don't need to see all of your work history from the early 2000s or the 90s or even the 80s. That stuff is outdated, okay? You do not need to put on when you graduated, the year that you graduated. You do not need to put that year either because they do not need to know how old you are. And they will be able to figure that out real quick if you start putting your graduation year on stuff, okay? Leave it off. Let them look at your resume. Let them see your cover letter that's well written, and so that way they can see, okay, this is a person I want to meet. Let me meet this person out of curiosity. Let me see what they have to offer. Then they can meet you, and that's when you put your best foot forward. Okay, I'm just saying. So with that said, you can do this, guys. You totally can. And especially when you go in and you meet them and you're confident about your skill, you're confident about the things that you've learned in your medical terminology and anatomy and pathophysiology, all that good stuff, the more confident that you are about that, the better off you would be. Because I'm not going to hire the person that doesn't know about medical terminology. I'm not going to hire the person who is very weak in anatomy, because that makes a heck of a difference when it comes to code selections. If you do not know your anatomy like enough where you can spot differences like coracoid and coronoid, if you can't spot the difference between those two, there is a problem. I'm just saying. And there's a lot of medical terms that are very similar to each other, but they are completely opposite, okay? So that's another thing that you got to know. But again, you want to talk about your experience that is going to transfer over. You're going to talk about, the skill that you've built and things like that. That's what you want to do. With that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.